Hello, my name is Karen Tavares. My topic is Ophthalmia Neonatorum. Definition. Neonatal conjunctivitis is often known as Ophthalmia Neonatorum and Latin name. It is defined as conjunctivitis occurring in a newborn during the first month of life with clinical signs of erythema and oedema of the eyelids and the palpebral conjunctivitis purulent eye discharge.
Hello, this is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about Ophthalmia Neonatorum. If your child's been diagnosed with Ophthalmia Neonatorum and is having fever, lethargy, that means it's difficult to wake up, or poor feeding. If your child appears ill to you in any way, he appears fuzzy, irritable, or in pain, if your child's symptoms persist or fail to improve despite the treatment, you should come back to the emergency department. Ophthalmia neonatorum is an inflammation of the conjunctiva, the covering of the eye, during the first month of life. It may be caused by a bacterial infection and may require additional testing like gram stains or cultures for diagnosis. The symptoms of Ophthalmia neonatorum include pink eye, redness, drainage, and lid swelling. You may also notice matting or sticking of your infant's eyelids in the morning. Treatment. The treatment of Ophthalmia neonatorum includes warm compress such as warm wet washcloth, daily saline eye irrigation, and oral or intramuscular antibiotics. Medications are generally used for 7 to 14 days. Occasionally, a second course of antibiotics is needed. Follow-up is very important. You should plan on close follow-up with your child's pediatrician or ophthalmologist within 2 to 3 days to ensure improvement. Sometimes the antibiotic needs to be changed, and we need to make sure there was no injury to the eye by the infection. For more videos like this video, please visit edxitvideo.com. And remember, these are educational videos and should never replace the care or attention of a medical healthcare professional.
Okay, application in nursing. The following bacteria can be passed to the baby during birth: gonorrhea and chlamydia. These are infections that are spread through sexual contact. Viruses that cause genital and oral herpes. This can lead to serious damage to the eyes. Therefore, the nursing staff is in charge of administering ophthalmic prevention to avoid these type of complications.
There'll be times that you have to give your baby eye drops, which sounds impossible, but in fact is very easy to do. If you put the baby on their back, this little baby is being very cooperative, sleeping peacefully. You're going to want to aim the eye drop for the inner corner of the eye, and if their eyes are closed, it doesn't matter because they'll blink it in if you just give it time. So drop the drop right in the corner of the eye, and then as you can see, their reflex is to close their eye hard, but it will seep slowly into their eye that way. Sometimes if it takes too long and I can see the drop sitting there for a long time, I'll very gently lift the eyelid and then the drop goes in. That's it. How was that? Was that terrible? And then you can wipe away the excess with a clean rag. That's it.
Okay, pros and cons. Pros. Prophylactic eye drop used routinely for all neonates. Applied to babies' eyes immediately after birth help prevent many infections. Cons. Blindness, corneal scarring, inflammation of the iris, corneal perforations, and pneumonia. Okay, issue appeared in Ecuador. A study in Ecuador mentioned that vertical transmission of chlamydia trachomatis occurring at 60 and 70% in children of infected mother, and the rise of acquiring chlamydia conjunctivitis in these neonates varies between 18 to 70%.
We have this 15 days baby. You can see the oral thrush infection in the oral cavity, and the patient presented with the discharge from the right eye since birth, so it's right, ophthalmia neonatorum. You should rule out congenital glaucoma and nasolacrimal obstruction as differential diagnosis. Any discharge during the first month of life is called ophthalmia neonatorum. The causes are, it can be due to chemical installation, due to herpes, due to chlamydia trachomatis. If it is very severe, then it could be due to gonorrhea. And the treatment is antibiotic ointment and drops and close follow-ups. Here we are also showing you another baby. It's 25 days old, and you can see that the one eye is looking smaller than the other. Yes, left ophthalmia neonatorum. Patient presented with left eye discharge, mucopurulent discharge. Causes are same, the differentials are same. So you should give antibiotic drops and ointments and close follow-ups. They improve very fastly. Thank you.
Okay, in conclusion, treatment of any maternal infection prior to delivery can help reduce the burden of this disease and also help to describe the incidence of childhood blindness not only in developing nations but also in developed countries. Thanks for your attention.
Ophthalmia neonatorum is the most common eye disease of newborn. It is a type of conjunctivitis which occur in infants younger than 4 weeks of age. With these words, I am Dr. Manish, and I welcome you all to another interesting clinical video on ophthalmia neonatorum. So let's start. 4-day-old male baby weighing 2.8 kilos presented with complaint of discharge from eyes since morning. Full term appropriate for gestation age baby delivered at home. 28-year-old mother didn't take antenatal care. On examination, purulent discharge is coming from right eye, resulting in a sticky eye. Both upper and lower eyelids are swollen. Purulent discharge is also coming from left eye. If you observe carefully, you will note congested bulbar conjunctiva, marked bruising and somewhat suffusion of the face is present as a result of face presentation. This type of face is considered the equivalent of caput with the face as the presenting part. Based on presenting complaint and examination findings, a diagnosis of ophthalmia neonatorum is made. Now let's have a look at causes of ophthalmia neonatorum.
Okay. Thanks for your attention.